Puberty blockers and cross-sex hormones are harmful and have cause permanent irreversible damage in these kids. When these children, they're non-persistent. If they wait, typically 80 to 90% of them are finding their biological sex by the time they get to that point. The controlled data substance database, when testosterone is used, the controlled substance database records that. Kids under 18, in 2015, there were just 5 that were using this. 2016, 32, 2017, 96, 2018, 189, 2019, 553, and this last year, 2020, 663. Even with COVID, there was a significant increase in the use of testosterone. Typically, this is being used for the purpose of transitioning.
My name is Cody Valera. I'm 40 years old. I transitioned when I was 32. I've been hearing a lot of people that are cisgendered, heterosexual, talking about topics that affect me. Now, let me be clear. When the doctor says, oh, some women have some body hair that they need to get rid of, that's not a big deal. Oh, it's just thickening of the vocal cords. Some women have a deep voice. That's not the point. The point here is that we have kids who are growing up and they're being told by media, by social media, and by therapists who have a bias towards the LGBT community that they need to be trans. And a lot of people are talking about, well, what is this uptick? You had 5 in 2015, and it's progressed exponentially since then. Well, in 2009, you had social media come to rise. So you have a lot more of what trans issues are and more of that in the media and in social media, and it's confusing kids. The fact these kids think that they need to be trans, they think they need to be LGBT, and by the time they're 18, they realize, no, they don't have to. But if they take puberty blockers or any other kind of hormone therapy, they have irreversible, not just damage, but they basically mutilated their body through medication. And unless they're able to mentally handle that, that is not healthy for them. And I am an exception. I am not the rule. Successful trans person does not usually happen. This is not the case. Somebody who can have a functional job, who is an entrepreneur, who has a pretty good position, has their their marbles together. That's not normal. Most trans people suffer from mental instability for a lot of reasons, and a lot of reasons that are put a Band-Aid on by just saying, oh, they're just trans. Let kids be kids. Let them explore who they are. Just because the little boy wears a dress at one point does not make them a girl. Just because the little girl wants to be a mechanic and she's been looking like a tomboy does not mean she needs to transition and take those dire steps that are permanent. We need to allow these kids to grow up. We need to allow them to experience life. And we need them to, by the time they're 18, then make a decision whether or not they want to have a family biologically. This is irresponsible not only on the medical practitioners, but also the parents.
My name is Danny Palmer with the Utah Eagle Forum. I'm a Stanford law grad who specializes in family law policy, and I have worked in 2 drug rehabs where most have underlying mental health issues. Of all the things that I've done in my life, the most fulfilling to me has been bearing children and being a mother. Permanently removing the ability to procreate by altering one's body is an adult decision that a person needs to make for themselves as an adult. Some parents are afraid that their child is going to complete suicide if not allowed to proceed with these permanent processes. Suicide ideation is a symptom of mental health conditions such as depression, anxiety, bipolar, ADHD, which have a common element of lower functioning prefrontal cortex, which is not fully developed until 25 years of age. Youth with suicide ideation have an even lower functioning prefrontal cortex, which makes them more at risk and more vulnerable. It's common to see impulsiveness, risk-taking behavior, depression, emotional volatility, and the inability to think through consequences. To allow a doctor to permanently alter a child with suicide ideation is beyond ethics. That child is not in a mental state to make permanent life-altering decisions. However, therapy is known to help prevent suicide and to help provide tools for a child to deal with difficult emotions and thoughts.
My name is Bob Burgraff. I'm just a citizen of Utah, though I am also transgender. I've dealt with being transgender since I was a child. We enact laws so as to protect the innocent and vulnerable in our communities. 70% of children, when allowed, will grow out of gender dysphoria. Why would we not protect them from harming healthy parts of their bodies.
My name is Billy Burley. I used to be transgender. When I was young, I had this continuous thought in my mind that God made a mistake. I was a girl. I tried to live with that thought for a long time, but it was very confusing. The therapy I received wasn't helpful, but I was told that if I went down the road of transition, that I would be happy. And boy, did I want to find happiness because I was miserable. So I did start on estrogen, testosterone blockers, and my emotions were up and down and my body was changing, but I was on this road to happiness and that made me happy. So in my first surgery, I had a penile inversion, an Adam's apple shave, a brow shave. After the surgery, there was bleeding from my vagina, which the doctors couldn't stop. They had a lot of gauze stuffed in my new vagina. I had a sandbag placed on my lower abdomen to stop the bleeding. I originally was supposed to stay in the hospital for 2 weeks, but I stayed there 3 weeks and I had to have a blood transfusion and plasma. That surgery to convert me to a female, to create a new vagina, was a 2-part surgery. So I had to go back for part 2 4 months later. After this, I had additional feminization surgeries, but no matter how many I had, every time I looked in the mirror, I saw a man staring back at me. I tried hard to resolve the conflict between my mind and my body, but after several years of trying, I had more problems at that point than I had when I started on the road of transition. After 7 years of presenting myself as female, decided to transition again, back to male. I do not have a penis, so sexual intimacy with my wife is limited. I do not have testicles, so I have to give myself an intramuscular injection of testosterone weekly. I have a pretty scarred up body as well, but I am married to a beautiful lady, beautiful inside and out, and I have peace of mind. I am a man, my birth gender. Praise God. I thank you for listening to me. I thank you for your time, and please help kids like me.
I'm a pediatric endocrinologist, board certified in practice in Atlanta, Georgia. I have a 40-year experience with the subject of transgender or transsexual health, as it was called 40 years ago. The concept of gender is a non-medical term. It is a sociologic and psychologic concept. It has no biologic basis, even though transgender advocates would have you believe otherwise. There are no studies. You cannot find a body in the morgue where you do a diagnosis and identify the biologic markers of an incongruent gender. There is no such test that proves that. It is a state of mind. So gender is not biologic, it is sociologic.
I was a trans kid, so insistent, persistent, and consistent that I was a boy that my teacher, Miss Hicken at Howard R. Driggs Elementary School, referred me to a school psychologist for assessment. The school psychologist noted that I wanted to be a boy, but thankfully she did not affirm me. She did not tell me that my self-hatred was valid, that my desire to run away from myself was something to be celebrated. She did not suggest that I be put on puberty blockers to induce a developmental delay that is not reversible. Instead, she put me in a special group for kids who needed extra support and helped me with my difficult feelings. What the school psychologist didn't know at the time, because I was so filled with shame and confusion, was that the reason I was insisting I was a boy is that I had been brutally sexually assaulted in the summer before kindergarten. It breaks my heart to imagine what life would have been like if the school psychologist had told me I was inherently flawed and that the only way to fix myself was to damage my body with puberty blockers, cross-sex hormones, and surgery. Doing so would have prevented me from getting the help that I needed to understand the trauma that I endured. No child is born in the wrong body, and we need to protect these children from these horrible interventions that are damaging their perfectly functional bodies and get them help that they need and deserve. Please stand up for our children.
Suicide threat is a sledgehammer that is used to make parents consent to their children being treated with affirmation socially, medically, and surgically. Our science is hard to bring to the forefront when ideology seems to trumpet at every turn. The professional societies that have developed guidelines, not standards of care, are professional societies where committees of of trans activist individuals get together and create a set of treatment guidelines for affirmation that is not based on science. The Endocrine Society has produced guidelines and a subsequent a revision of those guidelines in 2017, which are full of ideology and not science. Children are referred there by unwitting primary care physicians and by mental health professionals who are transgender activists. These kids get into the system, and immediately, the second that puberty appears, it is blocked with puberty blocking hormones, and subsequently cross-sex hormones within a matter of several years. And these children are permanently sterilized by this process. You will hear that this is a pause button, that using puberty blockers pauses puberty so that these children can decide whether or not they wish to go ahead and be affirmed medically with cross-sex hormones. In the truth, in this country, 100% of kids who come in and have puberty blocked proceed to cross-sex hormones within several years. Just to clarify, the guidelines from the Endocrine Society were put together by a committee of interested people. That committee had no broad spectrum background to develop those. They were only put together by trans activists. The American Academy of Pediatrics, an organization of pediatricians in this country, had the guidelines written by one individual. They were not reviewed by the membership or approved by the membership. These are troubled children. They are hanging on to the idea that a new gender will solve their problems.
The research literature are astounding. As you read through those, you're impressed by the fact that here are people who actually decided to have the operation or the chemical treatments later on, 18, 19 years of age, and still have huge regret numbers. We know that children go through many phases. They want to be an engineer, a fireman, or whoever, and they struggle with issues of family problems, and all of these things affect what they choose and what they want. My entire life, I have lobbied for and testified for between, even in this building, as well as in Washington, D.C., on Capitol Hill, about preserving children's opportunities.
There's no such thing as having the brain of the opposite sex. And there's also no such thing, even the most talented surgeon cannot transform a girl into a boy. And we all know this. We all know this. The problem is that kids and families are being misled away from those truths to believe in an altogether false ideology. As Dr. Van Meter mentioned already, that this is all, it's ideology. It is not science.
There is absolutely no published scientific experience which shows the safety and efficacy of medical transition of children. There are ample studies of adults who have done that, and the outcome shows no improvement in mental health, no decrease in suicide risk. Physicians take an oath to first do no harm.
I'm in support of this bill because it will protect vulnerable children and their families from the harms done by this, what I consider and what many of my colleagues consider a dangerous and disgraceful medical experiment. You've heard from Dr. Van Meter, and earlier you heard the statistics, the alarming statistics about the increase in the numbers of people that are being given, girls that are being given testosterone.
I'm Dr. Nicole Mihalopoulos. I'm an adolescent medicine doctor at the University of Utah. I'm not representing the University of Utah with my comments. I speak in opposition of House Bill 92. I am the medical director of the Gender Management and Support Clinic at Primary Children's Hospital, a multidisciplinary team of adolescent medicine, pediatric endocrinology, adolescent psychology, nutrition, and nurse coordination. We provide evidence-based care to hundreds of children, adolescents, and young adults, following the guidelines from the World Professional Association for Transgender Health and the Endocrine Society. These guidelines recommend treatment of severe gender dysphoria with 100% reversible puberty blockers after puberty has started to allow adolescents to continue to explore their gender identity as they continue psychosocial development. Additionally, the guidelines recommend that transgender youth live in their affirmed gender for at least 1 year and have seen a mental health provider who can provide information about mental health stability and insistent, persistent, and consistent identity in the affirmed gender before starting medications that feminize or masculinize. Just today, I got 10 new articles talking about benefits and risks of gender-affirming treatment for transgender youth and gender dysphoria. Recommend the use of puberty blockers, hormones, and for a few surgery, that it is life-saving. These treatments have been shown to improve mental health by decreasing depression, anxiety, and suicidal behavior that occurs with severe gender dysphoria. The proposed bill is dangerous to adolescents who seek or have started gender-affirming medical treatment and are younger than the stated age of 16 years for puberty blockers and 18 years for gender-affirming hormones.
There were some statistics presented earlier about the increased rate of patient use of these treatments. And we know that there are reasons why. Could you just explain? I mean, I think it's presented as an alarming uptake, but if you could speak a little bit to the fact that that uptake is just because of changes in science and then the data that we have. Could you speak to that from a medical perspective, please?
There's been an increased awareness of gender dysphoria as we see growth in the population, just 3 million people in Utah, crazy, right? And so if 0.7% of those are transgender, then we're going to see an increase in the absolute numbers. And then with probably social media and just better connectivity through the internet, people are becoming more aware and have words to describe how they feel that maybe they never had before. Where puberty blockers become dangerous is if they are given without any additional hormone added back, and they are given for years. The current standard around the country is puberty blockers in place for 3 to 5 years without the introduction of some type of sex hormone. That is considered to be safe. So we press pause on that feminizing puberty with a puberty blocker to prevent the body from further feminizing, allow her time to continue to explore her gender identity and develop in a psychosocial setting, figure out if truly that person identifies as male, assumes a male identity, masculine name, hormone or pronouns, presentation, God forbid, even uses, sorry, that was facetious, even uses the appropriate bathroom for how they feel. Okay, that is a really big deal and important for a lot of people because it is unsafe. They feel like it's unsafe, and that's terrible. So is living as a boy, you're even calling your child my son and using male pronouns. And we all make the decision at an appropriate age, ideally in line with where their cisgender peers are in puberty and development, to start a low dose of testosterone to initiate that puberty that is in a line with their gender identity. If for some reason, 5 years later, your child says, you know what, Dad? I don't know if that was exactly the right thing for me. They can stop their medicine. There are going to be some changes that are considered semi-permanent. Of those, a thickening of the vocal cords, which causes voice deepening. But there are many people who don't like their voices, and they can take voice training if they need it to sound the way they want to. Causes increased body hair and facial hair. Well, oh my gosh, there are lots of cisgender women who have lots of body hair and facial hair. I'm Greek. We spend a lot of money on hair removal.
There's some irreversible changes, but they can adapt to them, is what you're saying.
Correct.
Thank you.
So chest
Sorry, Ms. Mask, you
masculinization
can't-
surgery will perform those procedures in someone who has undergone all of the evidence-based standards of care and meets criteria to undergo those procedures.
So could happen just for a gender change under 18?
Yes.
My name's Dr. Jennifer Plum. I am an MD and an MPH. I thought I would take a sampling of patients that I've seen in the ER kids over the last couple of weeks. Sore throats, ear infections, fevers, broken bones, lacerations, appendicitis, a new onset cancer, a horrible trauma, mental health crises. These are situations that we are humbled to be part of a family's care with and these children. And every single one of these patients has a policy, a protocol in place that ensures we are providing medical standard of care to them. I call physicians to assist sometimes, whether that be a surgeon or an infectious disease specialist or an endocrinologist, whatever those children need. Do you know what I've never once done in 20 years of doing this? I've never stepped out of a room and thought to call one of you all. I've never thought to call a legislator and say, tell me how to best take care of this kid. Because I trust the national organizations and agencies, because I trust my colleagues. And I'll tell you what else I've never had happen. In the midst of sometimes truly terrifying situations with families, I've never had a family say to me, hey, Doc, you mind stepping out for a second? I need to call my legislator and ask what the best care is. That's not the world we live in pediatric medicine. I'm here to speak out for kids, I'm here to speak out for science, and I'm here to speak out for the hope that you trust us as medical care providers for your children. You trust us to follow in the steps that we've never done wrong with.
My name is Dr. Candace Metzler, PhD, and I'm the Executive Director of Transgender Education Advocates of Utah. I'm also a therapist with nearly a decade of experience working with LGBTQI individuals and their families. The sponsors of this bill have proposed that this is about protecting young children. And the crisis that's being made here, I failed to grasp because there is no real crisis. The bottom line is that the politicians should not be stepping in between the medical decisions of parents and their doctors. That an independent medical decision based on assessment and best practice approaches is the best that we should be able to allow any family to make decisions on behalf of their child. There are no such thing as transgender procedures.
This message bill claims that transgender kids don't exist, but they do exist, and they are my heroes. They are more courageous than I will ever be. I love them.
Marianne Martindale, Utah Academy of Family Physicians. We speak in strong opposition to this bill. We concur completely with the other medical experts who have spoken against this bill, so I don't want to repeat anything that they've said. This targets an extremely vulnerable population. We know suicide risks are much higher among those who experience gender dysphoria, but this bill will only exacerbate that risk by eliminating a medically proven but cautiously and judiciously used treatment options. Parents do not make these decisions lightly. Doctors do not make these decisions lightly. Treatment occurs within the safety and privacy of educated and informed consultation between doctor, patient, and parents. We oppose any legislation that would seek to come between the sanctity of a doctor and their patient.